You're listening to Geriatric Nursing and Palliative Care. Simplified Clinical Nursing Concepts, Daily Practice Guide with NCLEX-style questions and rationales, written by Mary Jane Millionaire, RN. Whether you're a nursing student, preparing for the NCLEX, a newly licensed nurse, an experienced clinician, or a caregiver looking to deepen your understanding of caring for older adults, this audiobook is designed to provide practical, easy-to-understand nursing concepts that can be applied in real clinical practice. Throughout this audiobook, you'll explore the foundations of geriatric nursing, common conditions affecting older adults, palliative and end-of-life care, medication safety, patient safety, communication strategies, case scenarios, quick recall guides, and NCLEX-style practice questions. The goal is simple: to help you build confidence, strengthen your clinical judgment, and provide safe, compassionate, and patient-centered care. Thank you for joining me on this learning journey. Let's begin. Part 1. Foundations of Geriatric Nursing. Chapter 1. Understanding Aging. Welcome to Chapter 1 of Geriatric Nursing and Palliative Care. In this chapter, we'll explore one of the most important concepts in nursing: understanding the aging process. Aging is a natural part of life. It is not a disease, but it brings gradual changes that affect nearly every organ system in the body. As nurses, recognizing these normal changes helps us distinguish between expected aging and conditions that require immediate medical attention. One of the biggest misconceptions is assuming that every health problem in an older adult is simply caused by old age. In reality, many symptoms that are often dismissed as normal aging may actually signal an underlying illness. Sudden confusion, weakness, frequent falls, or changes in behavior should never be ignored. These may be early warning signs of infection, dehydration, stroke, or other serious conditions that require prompt assessment. As people age, the cardiovascular system also changes. Blood vessels become less elastic, and the heart works harder to pump blood throughout the body. This increases the risk of hypertension, heart failure, and other cardiovascular diseases. Nurses should routinely monitor blood pressure, assess for dizziness, observe for swelling, and recognize signs of poor circulation. The respiratory system also undergoes age-related changes. Lung tissue gradually loses elasticity, making breathing less efficient. Older adults may have a weaker cough reflex, increasing their risk for pneumonia and other respiratory infections. Careful respiratory assessment, encouraging deep breathing, and promoting mobility are essential nursing interventions. The musculoskeletal system changes as well. Bone density decreases, muscle strength declines, and joints become less flexible. These changes increase the risk of falls and fractures, particularly hip fractures, which can significantly affect an older adult's independence and quality of life. Promoting safe mobility, assessing fall risks, and encouraging appropriate physical activity are important parts of nursing care. The nervous system is another area affected by aging. Reaction times may slow, memory may become less sharp, and sensory changes such as reduced vision or hearing can affect communication and safety. However, it's important to remember that normal aging is different from conditions like dementia or delirium. Nurses should always assess carefully rather than assuming confusion is simply part of growing older. The digestive system also changes over time. Older adults often experience slower gastrointestinal motility, reduced appetite, changes in taste, and decreased fluid intake. These factors increase the risk of constipation, dehydration, and malnutrition. Monitoring nutritional status, encouraging hydration when appropriate, and assessing bowel function are essential nursing responsibilities. Beyond physical health, aging also affects emotional and social well-being. Retirement, the loss of loved ones, chronic illness, and reduced independence can contribute to loneliness, depression, or anxiety. Compassionate communication, emotional support, and involving family members in care can have a significant impact on an older adult's quality of life. As nurses, our priorities extend beyond treating illness. We strive to promote safety, preserve independence, prevent complications, and maintain dignity. Simple interventions, such as preventing falls, protecting skin integrity, reviewing medications, and encouraging mobility, can dramatically improve outcomes for older adults. The most important lesson from this chapter is that caring for elderly patients requires careful observation and sound clinical judgment. Older adults often present with subtle or atypical symptoms, making early recognition one of the nurse's greatest responsibilities. As you continue through this audiobook, you'll build the knowledge and confidence needed to care for older adults safely, compassionately, and effectively. In the next chapter, we'll discuss comprehensive geriatric nursing assessment, where you'll learn how to perform a thorough evaluation of older adults and identify potential health concerns before they become serious problems. Chapter 2. Geriatric Nursing Assessment. In this chapter, we'll explore one of the most important responsibilities of every nurse caring for older adults, a comprehensive geriatric assessment. Unlike younger patients, older adults often have multiple chronic illnesses, age-related changes, and subtle symptoms that can make assessment more challenging. A thorough nursing assessment allows us to identify problems early, prevent complications, and develop an individualized plan of care. The assessment begins with a complete physical evaluation. This includes monitoring vital signs, observing general appearance, assessing pain, evaluating mobility, and identifying any changes from the patient's usual baseline. Remember that normal values may vary slightly in older adults, so it's important to consider the entire clinical picture rather than relying on numbers alone. Respiratory assessment is especially important because aging reduces lung elasticity and weakens the cough reflex. Nurses should assess breathing patterns, oxygen saturation, lung sounds, and signs of respiratory distress, while recognizing that older adults may not always present with obvious symptoms. Functional assessment is another essential component. Nurses evaluate how well the patient performs activities of daily living, such as bathing, dressing, eating, toileting, and transferring. Instrumental activities of daily living, including cooking, shopping, managing medications, and handling finances, also provide valuable insight into a patient's level of independence and need for support. Cognitive assessment plays a major role in geriatric care. Nurses should evaluate memory, orientation, attention, and decision-making ability while remaining alert for sudden changes in mental status. It's important to distinguish between normal age-related forgetfulness and acute conditions such as delirium, which often signal an underlying medical problem requiring immediate attention. Emotional health should never be overlooked. Older adults may experience depression, anxiety, loneliness, or grief due to illness, retirement, or the loss of loved ones. By asking open-ended questions and building trusting relationships, nurses can identify emotional concerns and provide appropriate support or referrals. Nutrition and hydration are equally important. Many older adults have reduced appetite, swallowing difficulties, poor dentition, or chronic illnesses that increase the risk of malnutrition and dehydration. Nurses should monitor weight changes, food intake, fluid balance, and signs of nutritional deficiencies while promoting safe eating practices. Skin assessment is another priority because aging skin becomes thinner, more fragile, and slower to heal. Regular inspection helps identify pressure injuries, bruising, skin tears, and early signs of infection before they progress into more serious complications. Fall risk assessment is one of the most critical parts of caring for older adults. Factors such as poor vision, muscle weakness, impaired balance, medications, and environmental hazards all contribute to falls. Identifying these risks early allows nurses to implement preventive measures that protect patient safety. Medication assessment is equally essential. Many elderly patients take multiple medications, increasing the risk of adverse drug reactions, interactions, and medication errors. Nurses should review every medication, verify dosages, monitor for side effects, and educate patients and caregivers about safe medication use. Ultimately, a comprehensive geriatric assessment is much more than completing a checklist. It is a holistic process that examines the patient's physical, emotional, cognitive, functional, and social well-being. By looking at the whole person rather than a single illness, nurses can provide care that promotes safety, preserves independence, and improves quality of life. In the next chapter, we'll discuss common geriatric syndromes, where you'll learn to recognize conditions frequently encountered in older adults and understand why early identification is essential for safe and effective nursing care. Chapter 3. Common geriatric syndromes. In this chapter, we'll discuss common geriatric syndromes, conditions that frequently affect older adults and often result from multiple age-related changes rather than a single disease. Recognizing these syndromes early allows nurses to intervene promptly, reduce complications, and improve patient outcomes. One of the most common geriatric syndromes is falls. Falls are a leading cause of injury, hospitalization, and loss of independence among older adults. Age-related muscle weakness, impaired balance, poor vision, medications, chronic illnesses, and environmental hazards all contribute to an increased risk of falling. As nurses, preventing falls begins with assessing risk factors, ensuring a safe environment, encouraging the use of assistive devices, and educating both patients and caregivers. Another important syndrome is delirium. Delirium is a sudden change in mental status that develops over hours or days. Patients may become confused, restless, disoriented, or experience changes in attention and awareness. Delirium is often triggered by underlying medical conditions such as infections, dehydration, medication effects, or metabolic disturbances. Because delirium is usually reversible when the cause is identified and treated, early recognition is one of the nurse's most important responsibilities. It's important to distinguish delirium from dementia. Dementia develops gradually over months or years and involves progressive memory loss, impaired thinking, and declining cognitive function. Unlike delirium, dementia is generally chronic and irreversible. Nurses caring for patients with dementia should focus on maintaining safety, promoting routine, supporting communication, and preserving as much independence as possible. Another condition commonly seen in older adults is depression. Depression is often overlooked because its symptoms may be mistaken for normal aging. However, persistent sadness, loss of interest, changes in sleep or appetite, social withdrawal, and feelings of hopelessness should never be considered a normal part of growing older. Nurses play an important role in identifying these signs, providing emotional support, and encouraging timely evaluation and treatment. Urinary incontinence is another frequent geriatric syndrome that significantly affects quality of life. Older adults may experience urgency, frequency, or accidental urine leakage due to weakened pelvic muscles, neurologic conditions, medications, or underlying illnesses. Nurses should assess possible causes while promoting skin integrity, dignity, scheduled toileting, and individualized bladder management strategies. Many older adults are also at risk for malnutrition and dehydration. Reduced appetite, swallowing difficulties, dental problems, chronic illnesses, and decreased thirst sensation can all contribute to poor nutritional status. Nurses should monitor food and fluid intake, observe for signs of dehydration, assess weight changes, and encourage balanced nutrition whenever possible. Sleep disturbances are also common among elderly patients. Changes in sleep patterns, chronic pain, medications, anxiety, and medical conditions may interfere with restful sleep. Rather than relying solely on sleep medications, nurses should encourage good sleep hygiene, reduce nighttime disturbances, and identify reversible causes whenever possible. Finally, the chapter discusses polypharmacy, which refers to the use of multiple medications. Many older adults take several prescription and over-the-counter medications every day, increasing the risk of adverse drug reactions, medication interactions, dizziness, confusion, and falls. Careful medication review, patient education, and collaboration with the healthcare team are essential to promote medication safety. The key message from this chapter is that geriatric syndromes often develop gradually and may present differently than in younger adults. Nurses must look beyond individual symptoms, recognize subtle changes, and understand that small changes in an older patient's condition may indicate a much more serious underlying problem. By combining careful assessment, early intervention, patient education, and compassionate care, nurses can help older adults maintain their independence, prevent avoidable complications, and improve their overall quality of life. This concludes Part 1, Foundations of Geriatric Nursing. In the next section, we'll begin Part 2, Common Conditions in Older Adults starting with cardiovascular disorders where we'll explore age-related cardiovascular changes, hypertension, heart failure, coronary artery disease, stroke, and the nursing interventions that promote safe and effective patient care. Part 2, Common Conditions in Older Adults. Chapter 4, Cardiovascular Disorders in Older Adults. In this chapter, we'll explore cardiovascular disorders commonly seen in older adults. As people age, the heart and blood vessels naturally undergo structural and functional changes that increase the risk of chronic cardiovascular diseases. Understanding these changes allows nurses to recognize early warning signs, prioritize patient safety, and provide timely interventions. One of the first concepts to understand is the normal aging process of the cardiovascular system. Blood vessels gradually become less elastic, causing the heart to work harder to circulate blood throughout the body. This often contributes to elevated blood pressure and reduced cardiovascular efficiency. While these are expected age-related changes, they also increase the risk of serious cardiac conditions. The most common cardiovascular disorder among older adults is hypertension, or high blood pressure. Often called the silent killer, hypertension may produce no obvious symptoms while quietly damaging the heart, kidneys, brain, and blood vessels. Nurses play an important role by monitoring blood pressure regularly, encouraging medication adherence, promoting a heart-healthy lifestyle, and educating patients about limiting sodium intake, exercising safely, and attending regular medical follow-ups. Another major condition is heart failure. Heart failure does not mean the heart has stopped working. Instead, it means the heart can no longer pump blood effectively to meet the body's needs. Patients may experience shortness of breath, fatigue, swelling of the legs and ankles, rapid weight gain due to fluid retention, and difficulty lying flat because of breathing problems. Nurses should monitor fluid balance, assess lung sounds, observe for edema, encourage daily weight monitoring, and educate patients about recognizing early signs of worsening heart failure. The chapter also discusses coronary artery disease, commonly known as CAD. This condition develops when fatty deposits narrow the coronary arteries, reducing blood flow to the heart muscle. Patients may experience chest discomfort, shortness of breath, fatigue, or in some cases, no symptoms at all until a heart attack occurs. Nurses should recognize symptoms promptly, monitor cardiac status closely, and reinforce lifestyle modifications that reduce cardiovascular risk. Another life-threatening condition covered in this chapter is stroke. A stroke occurs when blood flow to part of the brain is interrupted, causing brain cells to become damaged. Early recognition is critical because prompt treatment can significantly improve patient outcomes. Nurses should remember the FAST assessment, facial drooping, arm weakness, speech difficulty, and time to seek emergency medical care. Every minute counts when caring for a patient experiencing a stroke. After a stroke, many patients require rehabilitation to regain strength, mobility, communication, and independence. Nurses play a vital role in preventing complications, supporting rehabilitation efforts, promoting safe swallowing, preventing falls, and providing encouragement throughout the recovery process. One important lesson throughout this chapter is that older adults may not always present with the classic symptoms seen in younger patients. For example, a heart attack may present as unusual fatigue, weakness, confusion, nausea, dizziness, or shortness of breath rather than severe chest pain. Because of these atypical presentations, careful assessment and sound clinical judgment are essential. As nurses, our priorities extend beyond treating disease. We focus on preventing complications, promoting medication adherence, encouraging healthy lifestyle choices, monitoring for signs of deterioration, and educating both patients and families. Small interventions, such as recognizing subtle changes in breathing, monitoring fluid status, or identifying early neurologic deficits, can make a significant difference in patient outcomes. The key message from this chapter is that cardiovascular disorders are among the leading causes of illness and death in older adults. However, with early assessment, patient education, timely interventions, and compassionate nursing care, many complications can be prevented and quality of life can be greatly improved. In the next chapter, we'll discuss respiratory disorders in older adults, where you'll learn about age-related respiratory changes, pneumonia, chronic obstructive pulmonary disease, aspiration pneumonia, tuberculosis, oxygen therapy, and important respiratory assessment red flags every nurse should recognize. Chapter 5. Respiratory Disorders in Older Adults. In this chapter, we'll discuss respiratory disorders commonly affecting older adults and the important role nurses play in preventing complications and recognizing early signs of respiratory distress. As people age, the respiratory system gradually changes. The lungs lose elasticity, respiratory muscles become weaker, and the cough reflex becomes less effective. These normal age-related changes make it more difficult for older adults to clear secretions and fight respiratory infections, increasing their risk for serious illnesses. One of the most common respiratory conditions in older adults is pneumonia. Unlike younger patients, elderly individuals may not always present with a high fever or severe cough. Instead, they may develop confusion, weakness, decreased appetite, or a sudden decline in functional ability. Because these symptoms can be subtle, nurses must remain alert and perform careful respiratory assessments. Assessment includes observing the patient's breathing pattern, respiratory rate, oxygen saturation, lung sounds, and signs of increased work of breathing. Early recognition allows prompt treatment and reduces the risk of respiratory failure. Another important condition is chronic obstructive pulmonary disease, or COPD. This chronic lung disease limits airflow, making breathing progressively more difficult. Patients commonly experience chronic cough, shortness of breath, wheezing, and fatigue. During exacerbations, symptoms can worsen rapidly and require immediate medical attention. Nurses caring for patients with COPD should monitor oxygen levels carefully, encourage breathing techniques such as pursed lip breathing, administer prescribed medications, and educate patients about smoking cessation and avoiding respiratory irritants. Oxygen therapy should always be administered according to medical orders, as excessive oxygen in certain COPD patients may worsen carbon dioxide retention. The chapter also discusses aspiration pneumonia, a condition that occurs when food, liquids, saliva, or stomach contents enter the lungs instead of the stomach. Older adults with stroke, dementia, Parkinson's disease, or swallowing disorders are especially vulnerable. Preventing aspiration begins with careful swallowing assessment. Nurses should position patients upright during meals, encourage slow eating, monitor for coughing or choking, and collaborate with speech therapists when swallowing difficulties are identified. These simple interventions can prevent life-threatening complications. Another respiratory condition covered is tuberculosis, or TB. Although less common than pneumonia, older adults remain at risk, particularly those with weakened immune systems or chronic illnesses. Nurses should recognize symptoms such as persistent cough, weight loss, night sweats, fever, and fatigue while following appropriate infection control precautions to prevent disease transmission. Throughout this chapter, infection prevention remains a major nursing priority. Proper hand hygiene, vaccination, respiratory etiquette, early mobilization, adequate hydration, and encouraging deep breathing exercises all contribute to reducing respiratory complications in older adults. The chapter also emphasizes recognizing respiratory distress, one of the most urgent situations nurses encounter. Warning signs include rapid breathing, difficulty speaking, use of accessory muscles, low oxygen saturation, cyanosis, restlessness, confusion, and decreased level of consciousness. These findings require immediate nursing assessment and prompt medical intervention. As nurses, we must remember that older adults often show subtle changes before severe respiratory deterioration occurs. A patient who suddenly becomes unusually sleepy, confused, or less active may actually be experiencing hypoxia rather than simple fatigue. Careful observation and critical thinking can make the difference between early treatment and a life-threatening emergency. The key message from this chapter is that respiratory disorders remain a major cause of illness and hospitalization among older adults. Through thorough assessment, early recognition, infection prevention, safe oxygen therapy, aspiration precautions, and patient education, nurses play a vital role in protecting respiratory health and improving patient outcomes. In the next chapter, we'll explore endocrine and metabolic disorders in older adults, where you'll learn about diabetes, thyroid disorders, fluid and electrolyte imbalances, malnutrition, and the nursing interventions that promote safe and effective patient care. Chapter 6. Endocrine and metabolic disorders in older adults. In this chapter, we'll discuss endocrine and metabolic disorders commonly seen in older adults. These conditions affect the body's ability to regulate blood sugar, hormones, fluids, and electrolytes, making careful nursing assessment essential for preventing complications and promoting patient safety. As people age, the endocrine system becomes less efficient. Hormonal changes, reduced organ function, chronic illnesses, and multiple medications can all influence metabolism and the body's ability to maintain balance. Because these changes often develop gradually, nurses must recognize subtle signs before serious complications occur. One of the most common endocrine disorders in older adults is diabetes mellitus. Diabetes affects the body's ability to regulate blood glucose levels and increases the risk of cardiovascular disease, kidney damage, nerve injury, poor wound healing, and infections. Nurses caring for patients with diabetes should monitor blood glucose levels regularly, administer medications as prescribed, assess for complications, and educate patients about healthy nutrition, regular physical activity, proper foot care, and medication adherence. It's especially important to recognize the difference between hypoglycemia and hyperglycemia. Hypoglycemia, or low blood sugar, may present with sweating, trembling, hunger, dizziness, confusion, irritability, or even loss of consciousness if left untreated. Early recognition and prompt treatment are essential to prevent serious complications. Hyperglycemia, or high blood sugar, develops more gradually and may cause excessive thirst, frequent urination, blurred vision, fatigue, and dehydration. Persistent hyperglycemia increases the risk of long-term complications affecting multiple organ systems. Another priority discussed in this chapter is diabetic foot care. Reduced sensation caused by peripheral neuropathy makes it easier for injuries to go unnoticed. Nurses should perform regular foot assessments, encourage proper footwear, promote daily foot inspections, and educate patients about reporting wounds or signs of infection immediately. The chapter also introduces thyroid disorders, including hypothyroidism and hyperthyroidism. Patients with hypothyroidism may experience fatigue, weight gain, constipation, cold intolerance, dry skin, and slowed thinking. Because these symptoms often resemble normal aging, careful assessment is necessary to avoid delayed diagnosis. Hyperthyroidism presents differently, with symptoms such as weight loss, heat intolerance, rapid heartbeat, anxiety, tremors, and increased metabolism. Nurses should monitor for cardiovascular complications, medication effects, and changes in overall health status. Another important topic is fluid and electrolyte imbalance. Older adults are particularly vulnerable because the sensation of thirst decreases with age, kidney function gradually declines, and many medications affect fluid balance. Dehydration may present with confusion, weakness, dizziness, low blood pressure, dry mucous membranes, or decreased urine output. Nurses should closely monitor fluid intake and output, assess hydration status, encourage appropriate fluid intake when not contraindicated, and identify early signs of imbalance before they become emergencies. Electrolyte disturbances can also have serious consequences. Abnormal sodium, potassium, calcium, or magnesium levels may lead to muscle weakness, irregular heart rhythms, confusion, seizures, or altered mental status. Careful monitoring of laboratory results and patient assessment helps prevent life-threatening complications. The chapter also highlights malnutrition, a common concern among elderly patients. Poor appetite, swallowing difficulties, chronic illness, medication side effects, financial limitations, and social isolation can all contribute to inadequate nutrition. Nurses play an essential role by monitoring weight changes, evaluating nutritional status, encouraging balanced meals, collaborating with dietitians, and providing education that supports healthy eating and hydration. The key message from this chapter is that endocrine and metabolic disorders often develop slowly and may present with subtle symptoms in older adults. Careful assessment, patient education, medication management, and early intervention allow nurses to prevent complications and improve quality of life. In the next chapter, we'll explore neurologic and cognitive disorders in older adults, where you'll learn about dementia, delirium, Parkinson's disease, stroke-related cognitive changes, seizures, and the nursing interventions that support neurological health and patient safety. Chapter 7. Neurologic and cognitive disorders in older adults. In this chapter, we'll explore neurologic and cognitive disorders commonly seen in older adults. These conditions affect memory, movement, communication, and overall quality of life. Because many neurologic disorders present with subtle or unusual symptoms, nurses play a critical role in recognizing changes early and providing safe, compassionate care. As people age, the nervous system naturally undergoes changes. Nerve conduction slows, reflexes become less responsive, and some decline in memory and processing speed may occur. While these changes are considered part of normal aging, they should never be confused with serious neurologic disorders. One of the most common conditions discussed in this chapter is dementia. Dementia is a progressive disorder that gradually affects memory, reasoning, judgment, language, and the ability to perform everyday activities. Patients may forget familiar names, become disoriented, repeat questions, or have difficulty recognizing loved ones as the disease advances. Nurses caring for patients with dementia should provide a calm and structured environment, use simple and clear communication, maintain consistent routines, and promote safety while preserving the patient's dignity and independence whenever possible. Another important condition is delirium, which is very different from dementia. Delirium develops suddenly, often within hours or days, and is usually caused by an underlying medical condition such as infection, dehydration, medication effects, or metabolic imbalance. Patients may suddenly become confused, restless, agitated, or less responsive. Unlike dementia, delirium is often reversible when the underlying cause is identified and treated promptly. Nurses should never assume that sudden confusion is simply part of aging. Early assessment and immediate reporting can significantly improve patient outcomes. The chapter also discusses Parkinson's disease, a progressive neurologic disorder that primarily affects movement. Patients may experience resting tremors, muscle rigidity, slow movements, poor balance, and difficulty walking. As the disease progresses, swallowing problems, speech changes, and an increased risk of falls may also develop. Nurses should encourage safe mobility, implement fall prevention strategies, assist with activities of daily living when needed, and ensure medications are administered on schedule, as timing is essential for symptom control. Another important topic is the cognitive effects of stroke. Depending on the area of the brain affected, stroke survivors may experience weakness, memory impairment, difficulty speaking, impaired swallowing, or problems understanding language. Some patients develop aphasia, which affects their ability to speak or understand words. Nurses can improve communication by speaking slowly, using simple language, allowing extra time for responses, and encouraging alternative methods of communication when necessary. The chapter also introduces seizures in older adults. Although seizures are less common than other neurologic disorders, they may occur as a result of stroke, brain injury, infections, metabolic disorders, or medication reactions. During a seizure, the nurse's priority is patient safety. Protect the patient from injury, do not restrain their movements, avoid placing anything in the mouth, monitor the duration of the seizure, and assess the patient carefully once the seizure has ended. Throughout this chapter, one important message remains consistent: neurologic disorders often present differently in older adults. A subtle change in memory, personality, balance, or behavior may be the first sign of a serious medical condition. Careful assessment, ongoing observation, therapeutic communication, patient education, and collaboration with families and the healthcare team are all essential components of quality neurologic nursing care. The key takeaway from this chapter is that early recognition of neurologic and cognitive changes allows nurses to intervene promptly, prevent complications, and help older adults maintain the highest possible level of independence and quality of life. In the next chapter, we'll discuss musculoskeletal and mobility problems in older adults, where you'll learn about osteoporosis, arthritis, chronic pain, immobility, fall prevention, and nursing strategies that promote safe movement and preserve functional independence. Chapter 8. Musculoskeletal and mobility problems in older adults. In this chapter, we'll discuss musculoskeletal and mobility problems commonly experienced by older adults. Maintaining mobility is essential for preserving independence, preventing complications, and improving quality of life. As nurses, understanding age-related changes allows us to recognize risks early and implement interventions that keep our patients safe. As people age, bones gradually lose density, muscles become weaker, joints become less flexible, and balance may decline. These normal physiologic changes increase the risk of falls, fractures, chronic pain, and decreased mobility. Although these changes are common, they should never be accepted as unavoidable barriers to maintaining function and independence. One of the most common musculoskeletal disorders is osteoporosis. This condition causes bones to become thin, fragile, and more likely to fracture, even after minor falls or injuries. Hip, wrist, and vertebral fractures are particularly common among older adults and can lead to prolonged hospitalization, disability, and loss of independence. Nurses play an important role in preventing fractures by promoting adequate calcium and vitamin D intake, encouraging weight-bearing exercise when appropriate, implementing fall prevention measures, and educating patients about home safety. The chapter also discusses arthritis, one of the leading causes of pain and disability in older adults. Osteoarthritis results from the gradual breakdown of joint cartilage, causing pain, stiffness, and reduced mobility. Symptoms often worsen with activity and improve with rest. Rheumatoid arthritis, on the other hand, is an autoimmune condition that causes chronic inflammation, joint swelling, and progressive joint damage. Although both conditions affect mobility, they require different treatment approaches and nursing interventions. Nurses should encourage regular gentle exercise, pain management strategies, joint protection techniques, and assistive devices that help patients remain as independent as possible. Another important topic is immobility syndrome. Prolonged bed rest or limited movement increases the risk of pressure injuries, muscle wasting, blood clots, constipation, pneumonia, and loss of functional ability. Even short periods of immobility can have significant effects on older adults. Encouraging early mobilization, assisting with range of motion exercises, repositioning patients regularly, and promoting participation in daily activities are essential nursing interventions that help prevent these complications. The chapter also addresses chronic pain, which affects many older adults and can interfere with sleep, appetite, mood, and daily function. Effective pain management begins with a thorough assessment. Nurses should evaluate the location, intensity, duration, and impact of pain while considering both pharmacologic and non-pharmacologic approaches to improve comfort and quality of life. Perhaps the most important topic in this chapter is fall prevention. Falls remain one of the leading causes of injury and hospitalization among elderly patients. Risk factors include muscle weakness, impaired balance, poor vision, medications, environmental hazards, cognitive impairment, and chronic illness. Nurses can significantly reduce fall risk by performing regular assessments, ensuring safe footwear, removing environmental hazards, providing assistive devices when needed, maintaining adequate lighting, and educating both patients and caregivers about fall prevention strategies. Finally, the chapter emphasizes rehabilitation and functional independence. The goal of geriatric nursing is not simply to treat disease but to help older adults maintain the highest possible level of independence for as long as possible. Supporting patients in performing activities of daily living, encouraging physical activity within their abilities, and promoting confidence are all important aspects of quality nursing care. The key message from this chapter is that mobility is closely linked to health, independence, and dignity. Through early assessment, fall prevention, pain management, rehabilitation, and compassionate nursing care, we can help older adults remain active, safe, and engaged in their daily lives. This concludes Part 2, Common Conditions in Older Adults. So far, we've explored the foundations of geriatric nursing, learned how to perform comprehensive geriatric assessments, recognized common geriatric syndromes, and discussed major cardiovascular, respiratory, endocrine, neurologic, and musculoskeletal conditions affecting older adults. In the next part of this audiobook, we'll shift our focus from managing disease to providing comfort, dignity, and compassionate support. Together, we'll explore the principles of palliative and end-of-life care, where you'll learn how nurses help relieve suffering, manage symptoms, support families, and improve quality of life for patients living with serious illness. Coming up next, you've now completed Part 2, Common Conditions in Older Adults, covering the essential diseases and health challenges nurses frequently encounter when caring for elderly patients. But there's still much more to learn. In Part 3, Palliative and End-of-Life Care, you'll discover the core principles of palliative nursing, effective pain and symptom management, compassionate end-of-life care, and therapeutic communication techniques that support both patients and their families during some of life's most difficult moments. Next, Part 4, Practical Bedside Nursing Care focuses on everyday clinical practice. You'll learn medication safety for older adults, nutrition and hydration support, infection prevention, patient safety strategies, and effective caregiver and family education to improve outcomes both in healthcare facilities and at home. Finally, in Part 5, Clinical Applications and Case-Based Learning, everything comes together through realistic case vignettes, bedside scenarios, quick recall nursing guides, NCLEX-style practice questions with rationales, and practical survival notes designed to strengthen your clinical judgment and prepare you for real-world nursing practice. Whether you're preparing for nursing school, reviewing for the NCLEX, caring for older adults at the bedside, or supporting patients receiving palliative care, the remaining chapters are designed to help you become a safer, more confident, and more compassionate nurse. Thank you for listening to this audiobook preview of geriatric nursing and palliative care from the PulsePoint Nursing Series. I hope these chapters have helped you better understand the unique healthcare needs of older adults and strengthened your confidence in providing safe, compassionate, and patient-centered nursing care. If you'd like to continue learning through the remaining chapters, including palliative care, end-of-life nursing, medication safety, bedside nursing care, case scenarios, quick recall guides, and NCLEX-style practice questions, the complete ebook and printed paperback edition are now available on Amazon. You'll find the link in my bio. If you found this audiobook helpful, please support the channel by liking this video, subscribing, and turning on notifications so you won't miss future nursing audiobooks, clinical scenarios, NCLEX reviews, and practical nursing tips. Thank you for listening, keep learning, continue caring with compassion, and I'll see you in the next audiobook.